I'm going to be talking a little bit not only about the internet pharmacy market as a whole, but I'm going to focus a little bit on the so-called legitimate Canadian internet pharmacy market. And as part of that, I'm going to be sharing with you some information from some confidential informants we have within that industry for the first time. Let me tell you a little bit about LegitScript. We're a company of about 80 people in Portland, Oregon. We have the largest list of internet pharmacies that's out there. We work with both the public sector, FDA, DEA, DOJ, some of their counterparts in other countries. Work with Google, Bing, Amazon, Visa, Facebook, Pinterest, Twitter, a lot of different platforms, and need to make sure that if they're allowing internet pharmacies to use their paid services, that they're legitimate internet pharmacies. As a result of this, we have a lot of data about internet pharmacies, and we actually do a little bit over 100 purchases from various internet pharmacies, mostly illegal ones, around the world every month. So we have a lot of data about not only the internet pharmacy websites, but where the drugs are coming from and how that supply chain works. And I want to share with you how this market really works. So just a little bit of top-line data. First of all, this number changes, but roughly 40,000 internet pharmacy websites online at any one time. The US is the largest target market, in part because we have some of the highest drug prices on average. So obviously the rogue internet pharmacy operators are targeting the US, but not only the US. But about 90% of websites are in English because they're targeting here. 97% of internet pharmacy websites operate illegally. Now, these 40,000 or so websites, most of them boil down to about 125 to 150 networks. In other words, some of them operate 5 websites, some of them operate 50, some of them operate 5,000, but most of the websites are connected to other websites in some way. Now, as to the Canadian internet pharmacy market, and you'll see that I have this in quotes, most of the drug importation bills that have been out there currently and in the past would sort of result in these being potentially viewed as legitimate under the new legislation. So I'm going to focus a little bit on about 65 to 70 internet pharmacies that have a Canadian pharmacy license. You can actually walk into a brick and mortar pharmacy in Canada and they can wave around a Canadian pharmacy license. These are mostly members of an organization called the Canadian International Pharmacy Association, and here's a list right here. So here is what Americans are supposed to believe. CanadianPharmacyMeds.com is one of these licensed Canadian internet pharmacies. And the message is, we're just like your local pharmacy. We're just like you. We're Canada. We're a little bit cooler. We've got Justin Trudeau. You know, I mean, he's got great hair, right? But we're just like you. This is just like your local pharmacy. So the marketing is, it's Canada. Who could oppose importation from Canada? It's just as safe as the US pharmacy. These are licensed pharmacies. We can show you our pharmacy. You criticize drug importation, you must be part of big pharma. And that's really the message that has been out there by the Canadian International Pharmacy Association and their advocates. The only reason you would oppose this is for revenue reasons, for your company. But we want, they say, Americans to get the same drugs Canadians get. Well, now, let's look at this and see if it's true. Now, the first example I want to give you as we start to untangle this is onlinecanadianpharmacy.com. Real Canadian pharmacy. You can walk into a brick and mortar pharmacy that they have. They can show you a Canadian pharmacy license. But let's say you get on a Canadian IP address. IP address that's where you're accessing the internet from. We have servers all around the world, so we can get on our servers in Canada and operate on the internet as if we're getting to this website from a Canadian province. You try to order a prescription drug and it says, sorry, at this time we don't ship to Canada. They never ship to Canada. Now wait a minute, why would a Canadian pharmacy not ship to Canadians? What's going on here? Likewise, candrug.com. They have a real Canadian pharmacy license, real Canadian pharmacist. But these drugs right here, Comagra, that's not an approved Canadian medication. You can't get this legally in Canada. It's only available in India. If you walked into a Canadian pharmacy, you couldn't get this. So what's going on here with these last 2 slides? So here's how it really works. If you're a Canadian resident and you order from a Canadian internet pharmacy like this, you get the drugs from the Canadian pharmacy shelves. You get the same thing as if you walked into a Canadian pharmacy. Let's say that as a US resident, you order the drugs from this licensed Canadian pharmacy. What happens? Well, only in a very small number of cases do you actually get the drugs from Canada. What they do is they take the order, they send it to someplace like Turkey, India, Singapore, a number of different countries, and you'll see some proof of this here in a minute with some of the documentation, and it goes to a cheaper place than Canada, and not a pharmacy in most cases. It's usually not a pharmacy, it's a warehouse, something like that. It's routed through someplace like the UK, Canada, someplace like that, that to Americans is gonna seem like it's safe. It's gonna seem like, oh, this is a safe country where I can trust the pharmacies. But in Turkey or someplace like that, they've slapped a label on it. So you're not getting the same drugs as a Canadian resident would, even though that's the marketing. It's coming from someplace else. Now let's look and see why we should care about that. So this is what we call a bifurcated supply chain. CanadaDrugs.com. As background, currently under indictment here in the US for selling counterfeit drugs to their wholesale supply chain. But they're, the seal isn't here, but they're one of these licensed Canadian pharmacies that is approved. Now, I want to go back to a case that happened, I think it was 8 or 9 years ago. It was a trademark case, okay? So this was not a drug safety case, but it's relevant for reasons I'll explain in a minute. These judges in the UK that were looking at this trademark case had to make certain findings about this UK pharmacy that was serving as a transshipment point. In other words, not a real supplier, but just where the drugs were routing through that were coming to the US when ordered by US residents from a Canadian internet pharmacy, in this case, Canada Drugs. So here's what the judges found in their official findings. They said patients in the United States purchase and get prescription drugs in the following way. So to summarize this, they say, and this is copied from the judge's order, they order the goods from a Canadian company, CanadaDrugs.com, could be a different website. The prescription and the information is made available to the Canadian company. They then place an order with a Turkish company. The patient's name and address, all this HIPAA information, is supplied electronically. The Turkish company has stocks of the drugs. Now, in this case, it was genuine drugs. As we're going to see, there's a mix of genuine and counterfeit drugs that are in the supply chain. Then in Turkey, the dispensing label stuck on the product bears the words Complete Care Pharmacy. And what's important to know here is that's the UK pharmacy. But this was happening at a Turkish warehouse in the Turkish Free Trade Zone. You're not getting the same drugs as you'd get if you went into the UK pharmacy either. There are some people in the Canadian internet pharmacy world that don't believe that what they're doing is right. And because we're out there monitoring and we have all this data, they've shared some information with us. Here's an email from Eric Sigurdsson, who works for Canada Drugs, again, licensed Canadian pharmacy currently under indictment, to a supplier whose name I'm going to protect. He says, Eric, the above referenced order is destined to go to a Canadian address, and this is in one of the offshore locations, not Canada. Can I send the product? And Canada Drugs says, no, don't ship it. I'll take care of the order. Why? Because if it goes to Canada, you've got to send the real drugs from the Canadian pharmacy shelves. But that's the exception, not the rule. Normally, it's coming from another offshore location. They're currently under indictment as for activity that occurred, I think it was in 2011 or 2012, some counterfeit cancer drugs. But as far back as 2007, as I'll show you, they knew that some of the drugs they were supplying were likely counterfeit. Here's a facsimile that they sent to their offshore Turkish supplier. Basically, what it says is that we're in a legal dispute. This is the, by the way, here's what's interesting. Canada Drugs also has Canada Drugs Barbados, which is like a subsidiary where the drugs funnel through in Barbados, right? So there's a dispute with the UK government about some possibly counterfeit drugs going through the UK from Barbados to Turkey. I think actually that's supposed to be from Turkey to Barbados. And they assert it's counterfeit. Canada Drugs hires an expert who says, the seized medicines appear to be suspect. In my opinion, it's a poor copy of a genuine medicine. This has not been disclosed. And this sort of thing is happening fairly regularly. Now, wouldn't the drug importation bill, let's play devil's advocate here, by placing the Canadian internet pharmacies under some sort of a regulatory scheme under US jurisdiction, wouldn't it take care of this problem? Wouldn't that actually be an improvement? Well, couldn't we just extradite anybody who, even if they're not in the US, did something bad like this? Well, this article just came out about 3 days ago. It's from the Canada Drugs indictment. This guy was one of the ones, and he's over in Britain, who was supplying non-UK counterfeit cancer medications to the United States. And the long and short of it in this article is he's hired attorneys to fight extradition and say, I don't want to go face justice for the counterfeit drugs. So because it's extraterritorial, it's going to be really tough under any sort of a drug importation bill to actually hold people accountable and provide that deterrence to doing things like this. Now here's another example. This is the second of three. Jandrugs.com. They also are a real Canadian pharmacy, and if you walk into their pharmacy, you will get legitimate, safe drugs. But what about if you order online? This is just to show that they actually have a physical location, Calgary. Well, here's their reshipment procedure. This is no longer online. They've taken this down, but this has been their reshipment procedure, and I'll just read a little bit of it and then zoom in. If caught by the FDA, that's never a good sign when you start off your policies that way. Verify that reshipment of the drugs is sent to the appropriate group. We don't see Canada on this list. We see Fiji, we see New Zealand, the UK, and Brazil. New Zealand and the UK are not actually the sources of any pharmacies. Those are transshipment points as well. India, Turkey, places like that. Here is a typical and a real customer complaint that was sent to Jandrugs, a licensed Canadian pharmacy that sold online. It's from I'm protecting the patient identity here and their privacy, but I just wanted to share this is a US citizen. And the long and short of it is, he ordered Xenical from Jandrugs and says, ultimately, it has absolutely no effectiveness. I know I can't do anything about it, but I'm just letting you know that the Xenical that was sent through Turkey is not Xenical. We get a lot of complaints like this. Last example, Universal Drugstore. Also, again, common refrain, you can walk into a Canadian pharmacy. It would be one of these pharmacies that would presumably be okay under the new legislation. Well, here's an email from a foreign supplier, an offshore supplier, and there's a few things here I have to sort of untangle and explain. So this email is from this offshore supplier where he's saying, dear Jeff, who helps run universaldrugstore.com, I don't think we've met or spoken before, but I understand you probably know about us through Dan Norman, who also runs this internet pharmacy, and maybe through Andrew Strimpler. We recently shipped some product to your facility in Malta on behalf of RX North. RX North no longer around, run by Andrew Strimpler, who, in running RX North, went to prison for selling counterfeit drugs to US residents. Purportedly, he was operating a Canadian internet pharmacy, one of the founding members of the Canadian International Pharmacy Association. He went to prison, obviously no longer part of that. So this internet pharmacy writes back, this Canadian internet pharmacy, and says, yeah, we're interested in this, but hey, I have a request. My wholesale location in Malta is very secret, and I want it to stay that way. Why would a drug wholesale location need to be secret? There's no good reason for it. And in fact, we have all of these packing lists and the airway bills from this location, the exporter, not a pharmacy in the Turkish Free Trade Zone. That's just the waybill. So here's the marketing. Here's the public narrative. Certified Canadian internet pharmacies, which would be the ones subject to approval under this bill, have a 100% perfect safety record. That is simply false. For example, and this is not a complete list, in the last 5 years, you've got RX North, as I indicated, they're, well, not the pharmacy, they're operated, went to prison for counterfeit drug sales. Probably the #1 Canadian internet pharmacy for its wholesale supply chain, which is all the same and mixed in as the direct-to-patient supply chain. They're indicted, and they're fighting coming here to the US to be held accountable. The certification company that is widely used by the Canadian Internet Pharmacy Association, one of their directors was indicted for hiding counterfeit drugs in his garage. It was dismissed as part of a deal he made with DOJ to help them on some stuff. And then you've got, just in the last couple of months, a number of other leading Canadian internet pharmacies criminally charged for selling misbranded drugs not from Canada. And on numerous stages, some Canadian internet pharmacies have been aware that some of their drugs are likely to be counterfeit, but haven't disclosed that. So why is this problematic? Actually, importation itself is not the problem. I don't have a particular feeling for or against importation per se. The problem is an unregulated supply chain. We have virtually no counterfeits in the United States because it's a closed supply chain. What various forms of importation do, without giving the FDA the ability to actually continue to have it be a closed supply chain, is to open it up to potential counterfeits. Is it 100% counterfeits? No. But the question, I think, from a policy perspective is, how many counterfeits are okay? 10%? 5%? 1%? Any one of those is far worse than we have today. And finally, even though the narrative is appealing, drugs from Canada. Look, if you walk into a Canadian pharmacy, it's safe, it's good, no problem with that. But the internet is a different story, and I'm not aware of any Canadian internet pharmacies that are actually sending most of their drugs from Canada. So that's why I'm here to share that intelligence with you. Thank you.